Hey guys, I'm Mike. I'm an EMS instructor and a flight paramedic, and today we're going to be talking about bilevel positive airway pressure. So to start this video off, bilevel positive airway pressure goes hand in hand with continuous positive airway pressure, or CPAP. We have done a whole video on CPAP, so check out our YouTube channel on that video. We can put the link below for this video as well. And so there is a big difference between CPAP and bilevel positive airway pressure. And so CPAP, or continuous positive airway pressure, gives us essentially PEEP for our patients and high flow oxygen. So FiO2 is our fraction of inspired oxygen. It's going to deliver a high fraction of inspired oxygen as well as that PEEP for oxygenation of our patients. But for those patients that need ventilatory support, ventilation being our respiratory rate or our tidal volume, we need to utilize bilevel positive airway pressure. And so bilevel positive airway pressure is going to affect ventilation, so our tidal volume, the amount of air we breathe in at one time, or our respiratory rate. Now in the field, unless the patient's intubated, unless they're on a ventilator, we're not going to really be able to adjust their respiratory rate, but we can help with their tidal volume, and that's where that bilevel positive airway pressure, non-invasive ventilation is really going to be helpful for our patients. So CPAP is for oxygenation, PEEP and FiO2, and bilevel positive airway pressure is going to be for ventilation, and that's going to be our respiratory rate or our tidal volume. So who benefits from bilevel positive airway pressure? And so if you remember CPAP being an oxygenation issue, BiPAP is for those patients that need that extra ventilatory support. So think of our patients that are in respiratory distress that are getting really tired. So our COPD patients, our emphysema patients, potentially patients with a neurological disorder where they really just need that extra assistance from that bilevel support that's going to provide that increased tidal volume. It's going to decrease their work of breathing overall, and it's going to really help them with that issue. Some other patients that we may see are patients with pulmonary embolism, maybe a COVID type patient, and even our asthma patients. So patients that have asthma specifically, a lot of times it is an oxygenation issue, but what happens with our asthma patients is they have no problem getting the air in, but they have a problem getting that air out. And so over time, if you think about it, our bodies are wired to breathe in with our respiratory muscles, but passive exhalation. And so with asthma specifically, when it's a tough time getting that air out, we don't have the musculature to really breathe against that resistance. And so those patients can get very tired. And what bilevel will actually do over CPAP is we can really lower our expiratory positive airway pressure to allow for our patients to be able to breathe in easier, taking that workload off of those patients' respiratory status and allowing them to decrease their work of breathing. Let's break down some terminology for bilevel positive airway pressure. Some terms that we need to know is going to be IPAP, or inspiratory positive airway pressure, EPAP, or expiratory positive airway pressure, peak inspiratory pressure, or PIPS, and pressure support. So IPAP is going to be, or IPAP, or inspiratory positive airway pressure. That is the pressure delivered when the patient takes a breath in during the inhalation phase. And what the ventilator or the bilevel positive airway pressure system that you're utilizing is going to deliver a certain pressure when it senses the patient taking a breath in. EPAP, or expiratory positive airway pressure, is going to be the pressure delivered when the patient is in their exhalation phase. And with bilevel positive airway pressure, we can make those numbers different, okay? The difference between those two numbers, the IPAP minus the EPAP, is going to be our pressure support. And so that difference between IPAP and EPAP is actually what's going to help our patients take a deep breath in. You can think of it like if you have a BVM over your patient's face, when they take a deep breath in, you're just giving a little squeeze on that bag to really assist their tidal volume and assist that respiration or that ventilation. Another term we need to utilize is peak inspiratory pressure, and that's going to be the maximum pressure that is inhaled into a closed system. That's basically the pressure against our lungs and our alveoli when we take that breath in. Really what a maximum pressure we want to utilize is anything below 30 centimeters of water. That's going to be kind of our maximum safe peak inspiratory pressure. CPAP is going to deliver a constant positive airway pressure, and really when we talk about bilevel positive airway pressure, the EPAP is really what CPAP does constantly. You can kind of think of it as PEEP, and positive airway pressure is going to be our PEEP with CPAP, whereas in bilevel positive airway pressure, remember we have that difference. That's really going to help us with that ventilation, because it's ventilation versus oxygenation. And so that's really the big difference between bilevel positive airway pressure and continuous positive airway pressure. When we have a patient on bilevel positive airway pressure, we need to monitor a few different things. Number one being our patient's mental status and their airway status. Just like if we were to apply CPAP in a patient, we really need to make sure that they are able to maintain their airway, they're able to follow commands, and if you have the ability, we want to monitor tidal volumes if you're using a ventilator, or just visually looking to make sure they have adequate chest rise and fall, they're getting adequate tidal volumes, and that they are able to have good rate, rhythm, and quality of their ventilation overall. And so with our monitor as well, we can monitor our blood pressures, our SpO2, and then end-tidal CO2. So with CPAP, we're really concerned about our SpO2 because that's oxygenation. The number that we utilize for ventilation is going to be our end-tidal CO2. And so you can put on an end-tidal CO2 nasal cannula. It may not be the most accurate waveform with a non-invasive ventilatory system, but what you can do is you can trend your numbers over time to see if you're getting that therapeutic effect from that bilevel positive airway pressure. Some contraindications of bilevel positive airway pressure is going to be a lot of the same as our CPAP. And so we want to have a patient that can follow commands. We want a patient that has a blood pressure that's going to be above generally 90 to 100. It kind of depends on your local protocols. Because remember what happens when we're introducing pressure into our lungs, it's going to increase that intrathoracic pressure, which decreases that venous return to the heart. So it can cause some hypotension overall. And so we want to make sure that our patient has the blood pressure to support this non-invasive ventilation. If our patient has any decreased mental status to the point where they're not able to protect their airway, a lot of vomiting overall where we may have to manage that airway with the mask in the way, that's going to be a pretty relative to absolute contraindication if they are actively vomiting. So not a patient we generally want to utilize bilevel positive airway pressure with. Some additional contraindications, especially depending on where you work, is going to be age-related. So some agencies don't allow for CPAP or bilevel positive airway pressure on patients under 8 years old. And another thing to watch out for in general with non-invasive ventilation is potential for pneumothorax. So make sure you're listening to those lung sounds, make sure you're watching your patients' respiratory status, their respiratory rate, listening to those lung sounds, and making sure that we're not causing any pneumothorax or that there wasn't one there that we are exacerbating it by applying that additional pressure to that system. Some tips and tricks when using bilevel positive airway pressure. Number one, make sure you are acting within your scope of practice and local protocols. This is not going to be an option nationwide. It's going to be dependent on your agency and probably your state whether or not you're going to be able to utilize bilevel positive airway pressure. So when you do apply this system though, the biggest, most important thing you need to do is one, talk to your patient. Let them know what's happening. They're scared, they're having a tough time breathing. You're going to put this really loud and potentially mask on their face in this really stressful situation. And so it's going to be your demeanor and the way you handle that situation that's going to help calm your patient down and help them accept that mask and really let that mask do its job, okay? And so once you've decided to apply that bilevel positive airway pressure, we're going to make sure we have an adequate seal. And so you need to have an appropriately sized mask. You want that mask to fit over the bridge of their nose, over their chin, on their cheeks. Make sure you have a really good seal on the top, bottom, and on the sides. And then apply that harness to make sure it's a nice, snug fit. after you've applied that mask to that patient, we generally don't take that mask off until we get to the hospital. And so what you want to do is you want to make sure you have plenty of oxygen depending on where you start that non-invasive ventilation. If it's in somebody's house, if it's in a situation where you need to get to your ambulance, make sure you have enough detank oxygen to get that patient to your ambulance, and make sure your ambulance has enough oxygen to get that patient to the hospital. So it can take a long time from the time we apply non-invasive ventilation until the time we get to the hospital. So you want to make sure you are continuously not only monitoring your patient, but you're monitoring how much oxygen that you have being delivered to your patient. Now, there are a lot of different BiLevel positive airway pressure systems out there. And so whatever you utilize with your agency, you need to be really well versed in applying that to your patients in different settings. So break out whatever system you use, practice with your partner, practice with a mannequin, practice moving patients with this system in place. And that goes from setting it up, talking to your patient, applying the mask to your patient, and moving that patient in and out of different environments. That can go a really long way in making this a smooth call when you actually have to apply it to that critical patient. You don't want the first time you break out this CPAP or this BiLevel system to be on that critical patient that absolutely needs this right now. So make sure you practice with this, with whatever device that you utilize, and you know it very well. And so once you've applied this, your BiLevel positive airway pressure, some things that we can look for is if it's on a ventilator, the nice thing is with flow sensors, with the technology there, is you can monitor tidal volumes, you can monitor if there's any leaks that are going to show on your ventilator, you can monitor very specifically the pressures being delivered on the inspiratory as well as the expiratory phase. But if you don't have that available, and that's okay, we really need to have that good physical assessment of our patient, listening to things like lung sounds, looking at the rate, rhythm, and quality of their ventilations, and again, looking at their mental status, their airway status, and just trending all of that over time from the time you apply that mask to the time you get to the hospital and hand that patient off to the receiving physician. Today, we're going to be demonstrating a device by Mercury Medical. It's called the Flow-Safe II disposable BiLevel CPAP system. And this is a really nice device. It's completely disposable, as I said. It's pretty small and lightweight. It can fit nicely into your first-in bag or your airway bag. I actually have quite a bit of experience with their CPAP and their BiLevel system. It's a really good, it has a really good mask to it. That's probably my favorite part about this system, is it has this kind of double seal technology. And I have yet to not be able to obtain a seal on a patient as long as I'm utilizing the device appropriately and applying that correct size mask. And so this is a good system that doesn't utilize a ventilator. It actually hooks right up to your oxygen tank. And so it's going to be very portable. It uses less oxygen than a ventilator-based BiLevel positive airway pressure system. And it's going to be just a really simple, easy device to use. And I think it can be really helpful for especially those agencies that don't want to buy ventilators to be able to utilize BiLevel positive airway pressure. And for outlying, hospitals or facilities like that, it's a good system to help for those patients that don't just need CPAP. They need that ventilatory support that you get with BiLevel. And so today we're going to demonstrate applying that mask and talk about some of the tips and tricks with applying that mask. One of my favorite things about the mask on this device is it has a double seal technology on it. I've had really good luck getting seals on all of my patients with this, as long as you have the appropriately sized mask. And another thing I like about this mask as well is this device actually comes apart. And if you have a patient that needs to give something like nitro to or need access to that patient's face, this pops off very easily and very quickly. And so that's a really nice design about this particular mask. And so now that we have talked about how we're going to apply this to our patient, let's actually demonstrate it, okay? Chris right here, this is my boss. He's going to be our patient. He's going to be who I'm going to demonstrate with today. And so I want to kind of talk to Chris with what's going to happen. So Chris, you're having some difficulty breathing, okay? This mask is really going to help you, okay? So I really need you to just trust me here. I'm going to put this mask on your face for a little while before I apply this harness. It's going to be a tight fit, but it kind of has to be that tight, okay, to create that good seal. It's going to make some noise, but just take some nice deep breaths and trust me, okay?
Okay.
All right, so now I'm going to apply the flow or the oxygen to my mask. So I'm going to start at 8 liters per minute. Making sure everything's tight on all the connections. It's in CPAP mode. Everything's all connected here. All right, now I'm going to apply this to Chris's face. All right. Making sure that I'm having a good seal on his face. All right, so that at this point, I'm making sure I don't have any major leaks, which I don't. The manometer is actually going up and down. It's not staying at 0, which is going to be a big clue. And after 30 seconds to a minute, I'm going to actually apply this harness. All right, Chris, I'm going to pop this over your head, making sure it's nice and centered on the patient. Okay. And then this is going to come around and connect to our mask. And if it's too tight, I can adjust it at this point to make it more comfortable for Chris. And if you have a partner, this is where your partner could really help you out as well. But if not, this will do just fine. And so right now, I'm making sure that this isn't having any leaks, which it's not. I'm going to adjust my straps. Okay. And so now this mask is on appropriately. It's over his nose. It's around his face. If I need to access this, I can pull this system off. Now, every time Chris takes a deep breath, I look at the manometer at that peak inspiratory pressure, which is going to be the maximum amount of resistance going into our patient's airways. And so Chris is breathing in, and I'm getting a reading of 5 centimeters of water pressure as his CPAP, so that continuous positive airway pressure. And so at this point, we adjust our flow up to achieve 10 centimeters of water pressure, still in that CPAP mode. Okay, nice deep breath, Chris. Good, and now I'm seeing that manometer is at 10 centimeters of water pressure. And at this point, we can switch to that BiLevel mode. And to do that, we just turn this green dial here into BiLevel, okay? So now every time Chris takes a deep breath, that inspiratory positive airway pressure is going to be that max setting where that manometer reaches to. And so what I'm looking for is his inspiratory pressure, which is going to be 10 centimeters of water pressure. And then I can dial in my expiratory positive airway pressure. And so that's going to be still that CPAP mode, that kind of PEEP that Chris may need as well. And so the difference between that inspiratory positive airway pressure and that expiratory positive airway pressure is our pressure support. And that is what achieves that ventilation support that the BiLevel really helps with our patients. And so right now, I see that Chris has an IPAP, inspiratory pressure of 10, and I want to set the EPAP. And so this is done with this dial here. And I'm going to adjust it until I get 5 on my EPAP. And that will just show me that when the manometer reaches, when he breathes in, I look at the number that the manometer reaches. It's reaching 10 centimeters of water pressure. That's my IPAP. And then at rest, it will rest at another number, and it's resting at 5 centimeters of water pressure. That's my EPAP, or my PEEP, okay? And so once I've applied my BiLevel system to my patient, and I get the appropriate IPAP and the EPAP, then I'm going to watch my patient for his mental status. I'm going to watch his airway status, making sure that he can still follow commands. I want to monitor my vital signs, my blood pressure, my SpO2, and end-tidal CO2 can be really important in these patients that need ventilatory support, because remember, we are assisting with ventilation. So the thing we need to look at is our end-tidal CO2 and trend those numbers over time. And then overall, the work of breathing of our patient. Is he having an adequate tidal volume? Is his work of breathing going down? Does it seem to be really helping his mental status? And so this is going to be the things that we really need to look for. Now, the maximum IPAP that this system can deliver is 13 centimeters of water pressure. And this manometer, in case the patient, the max peak inspiratory pressure that this system can do before this pop-off valves come into play is 25 centimeters of water pressure. So it's a really safe system. It's going to not deliver too much pressure, which is important. With that in mind, just continually monitoring our patients, making sure we have enough oxygen available, and just reassessing constantly. Okay? All right, so that's how we demonstrate the BiLevel CPAP system. All right, everybody, thank you for watching our video on BiLevel positive airway pressure, and thank you to Mercury Medical for sending us that Flow-Safe II disposable BiLevel CPAP system. If you have any questions or you guys want to check out our other videos, check out our YouTube channel. We have videos on all sorts of topics, and let us know if you guys want to see any other different future videos or any more videos just like this.